You need to feel that the therapist gets your kid. You need to ask them, have they had experience working with this population? And you'll know, because at this point, the parents are going to be really savvy, or more savvy than any therapist who doesn't know. Right. So if there's red flags, if they don't know a major term, if you go to a therapist for OCD and they don't know the term ERP, that's a big red flag.
Right.
Because I've seen kids that had OCD and the therapist thought that they were delusional and thought that they were dangerous because they had harm OCD. And so it's really important that a therapist knows what they're doing when they're working with a vulnerable child. And you also want to make sure that you hear words like neurodiverse affirming,
right? Because
that's really important. A lot of people have been pro teaching kids about masking, and now we're trying to be more accommodating to their actual personality and their comforts. So that's important to find out, what's your role with that. I would say definitely ask about the specifics, and if they can talk on it, that's great. If there's a mention on the website about it, that's a good sign. People on a website that have everything listed as a specialty is a red flag. So you really need to look into who this professional is. Do you know anybody who's also worked with them? Things of that nature. If you just also get a gut feeling that it's not right, I would stick with that.
Right. Absolutely.
And also, if you are looking for a certain type of specialist and it's really hard to find it in your insurance, you can reach out to your insurance, and I'm sure you know this better than me, and they can make an exception to pay an out-of-network provider.